Hey, welcome to The Explainer. Today, we're diving into a piece of technology that honestly sounds like it's straight out of science fiction, but it could be our reality very, very soon. We're talking about a pacemaker for the brain, designed to treat mental illness. So let's get into it and see how this thing is supposed to work.
But before we get into the cool tech, you really have to understand the problem we're up against. And it kind of comes down to this one stark number, 60%. Get this, that's the percentage of psychiatric patients who just don't respond to their first treatment. I mean, that's a staggering failure rate, and it really highlights the crisis we're facing in mental health care today.
So, here's how we're going to break it all down. First, we'll look at why the current system is in crisis. Then, we'll introduce this wild idea of a brain pacer. After that, we'll explore the 5 senses technology behind it, look at the plan to actually bring it to market, and finally, we'll ask the big question: could this really rewrite the future of mental health care?
All right, first up, a system in crisis. Before we can really appreciate this new solution, we've got to get a handle on the deep, fundamental problem this is all trying to solve.
Okay, so think about it. Right now, how do we diagnose mental health issues? It's all based on what a doctor can see and what a patient tells them. It's subjective. The source material uses a great analogy. It's kind of like trying to diagnose engine trouble just by listening to the weird noises it's making, without ever actually popping the hood to look at the engine itself.
And when everything is based on these subjective descriptions, what happens? The diagnoses themselves end up being, inconsistent and unstable. You could have different doctors interpret the same symptoms in totally different ways. A patient's diagnosis might even change over time, not because their brain has changed, but just because the story has.
So what's the end result of all this? It leads to what the source calls trial and error medicine. And if you've ever known someone who's gone through it, you know exactly what this means. Patients are just cycling through different medications, different therapies, just hoping that one of them finally clicks. It's just this painful cycle for millions of people, inefficient, super costly, and just deeply, deeply frustrating.
Okay, so if the big problem is that we can't look under the hood, this next company believes it has finally built the tool to do it. Let's move on to Section 2, the Psychiatric Brain Pacer, a proposal to measure the brain directly.
And their whole idea is wrapped up perfectly in this one line. To get it, just think about a cardiac pacemaker for a second. What does it do? It detects an irregular heartbeat and sends a little electrical pulse to get it back into rhythm, right? Well, this is the same idea but for the brain. It's a device that could detect irregular brain activity and deliver a targeted stimulus to correct it. That, in a nutshell, is neuromodulation. Okay, sounds amazing, but how does a brain pacer actually work? That's what brings us to Section 3, 5 senses for the brain. And while it sounds like something from a movie, the process is actually surprisingly logical. It really all boils down to this simple 3-step process. First, a wearable device extracts what they call a digital signature of your brain and your behavior. Second, a powerful AI algorithm sifts through that data to discover the specific pattern, the mechanism, that's causing the problem. And finally, the device delivers a targeted corrective stimulus to correct that pattern, with the goal of eliminating the symptoms. Extract, discover, correct. Simple. So how in the world does it capture this digital signature? Well, it uses 5 different types of sensors, kind of like giving the device 5 senses of its own. It's got EEG to measure brainwaves, but it also has eye tracking, motion sensors, GPS, and even microphones to analyze your voice. By combining all 5, it creates this incredibly rich and, more importantly, objective picture of a person's mental state. And this slide? Wow! It just illustrates the whole concept perfectly. Just look at the difference here between a digital signature for major depressive disorder and one for a manic episode. With depression, the eye tracking shows a bias toward negative things, the GPS shows that person isn't moving around much, and their voice might be flat and slow. But with mania, you see the exact opposite. The gaze is hyper-exploratory, they're traveling way more, and their speech is fast and pressured. The point is, these aren't feelings or descriptions anymore. These are hard, objective, measurable data points. It's a total game changer. All right, the tech is obviously fascinating. I mean, it's mind-blowing. But can you build a real business around it? Let's get into that in Section 4, From Lab to Market.
To really wrap your head around the business opportunity, you have to first grasp the sheer scale of the problem we're trying to solve. By 2030, the projected global economic cost of mental health is $16 trillion. That's not a typo. That's the size of the need.
So
how do you even begin to tackle a $16 trillion problem? You can't just boil the ocean, right? Well, Neurotreat's approach is actually really strategic. They're starting with a focused $500 million beachhead market, academic and research labs. This is a brilliant move because it gets their tech validated by top experts before they even think about scaling up to that massive $150 billion wearable health industry. And their plan to actually make money is pretty straightforward. It's a hybrid model. First, they make money from a one-time sale of the wearable hardware itself. But then, and this is key, they generate recurring revenue through a subscription fee for their cloud-based AI analytics platform. Okay, so we've got the tech, we've got the business model. What's the actual game plan? That's Section 5, the 5-year mission. So they've got this really smart, phased rollout planned. They're going to kick things off in 2025 by launching a research kit. This puts the technology into the hands of experts for validation without needing that complex, expensive medical device approval right away. From there, it's a logical progression. Pilot studies, formal regulatory submissions in 2027, with the big goal of getting FDA and CE approval for a full market launch by 2028. And to get all of this off the ground, they're looking to raise $3 million in seed funding.
And they're super clear about where that money's going. Almost 3/4 of it is going exactly where you'd want it to, on the stuff that matters most, product development and proving that it actually works. 40% is for building the physical prototype and manufacturing, and another third is for those absolutely crucial clinical studies.
So, all of this leads us to our final section, and really the biggest question of them all. Are we actually watching someone rewrite the future of medicine? Let's zoom out and look at the ultimate vision here.
You see, their ambition is way bigger than just a single cool gadget. The grand vision here is to build the definitive platform for mental wellness, an entire ecosystem of connected devices that don't just react when someone's in a crisis, but can actually predict it, enabling early, personalized treatment before a person's life gets derailed.
And that leaves us right here with one really profound question. Could a technology that can literally measure and correct brain activity, could that finally be the end of trial and error psychiatry? If the answer to that is yes, well, that changes everything for millions and millions of people.